Our institution was originally with Rainbow Hospice and Palliative Care, and we were merging with a larger health system. And we chose to use the Tipping Point Challenge as a way of educating a lot of the palliative care team that was first coming on, that was going to be integrating into those hospitals. And it was a major push to try and get up to those guidelines, making sure that everybody was having the same education piece that was coming into it, and that we were all coming from the same educational basis, so we could have it amongst the ministries of the hospitals that we worked for, that we were all having the same educational background, and we were all getting the same baseline for meeting the challenges that would be coming up with developing an inpatient palliative program across the ministries. So since that time, it's expanded into our organization. And while we were developing the inpatient palliative program, we also had shared it with the hospitals that we worked with. And it was part of that ministry program so that it was available to people that weren't just with our particular agency to share the whole process of palliative care and pain management, symptom management, having those conversations of those really difficult conversations, because I think that's a big piece where a lot of non-palliative people could really benefit from, is having some of those really, really tough conversations. And the CAPC modules that really talk about those hard conversations and how to approach some of those conversations were really helpful. When we were first starting out, we had it as, like I said, an education piece for our particular institution. And we used it as a weekly, if not bi-weekly, get together via conference line. So we read the modules, we went through the modules, and then we had breakout sessions as to what we thought about the modules and what did we learn from the modules and how we can improve on our pain management, how we can improve on our symptom management. Some of the modules with communication were exceptionally helpful for me. I thought I was very good at communicating those various tough conversations with patients and families. But for me personally, it was exceptionally helpful when I was studying for my ACH PAN exam. And a lot of those modules revolving around communication and those specific pieces, and putting a whole comprehensive look into answering those questions made it exceptionally helpful for me when I went for that exam. So thank you for CAPC, I passed my exam. But it has developed where it's allowed not only the people with our organization to have those, and each new orientee that comes through, especially with palliative care, goes through all of those modules. And we have that as part of our onboarding, and that we're all meeting those criteria, and we're all at the same base, and we're all coming from the same base. And it incorporates so many of those guidelines and so many of those various changes that are out there. So it keeps you on board, and it keeps you current. And current is a big piece, because palliative care is forever changing, and so those modules have greatly helped. We were also able to talk with people that were also part of the hospital and said, these modules are available to you. Please utilize these modules. And I, for one, have actually brought that up at various committees I've been at, and say, if you've got any questions on it, it's here for you. It's part of our merger process, and those are modules that you can download and look at. And it was amazing to a lot of physicians as well as other staff members that they had that opportunity to look at that if they needed to, or if they so desired to do that. So that was a big positive.